So I presented during the Styron Congress study about implementation and feasibility of patient remote monitoring in older adults with cancer. It's a real-world study with about data from a data warehouse in France and Belgium, around 56 centers in France, and more than 2,300 patients. The data come from a data warehouse from Resilience, which is one of the biggest remote patient monitoring providers in Europe. So we collected all the data for the patients, and we studied the patients older 65 years old, which represents 43% of the total populations. So there were few oldest old patient, more than 85, with 92 patients, but in total, the study population is 2,300 patients. Yes, so we studied many endpoints as the usage patterns of the device. So we saw that older people used both mobile app and web applications. We saw that the oldest old patients have a longer time to answer the questionnaire because the patients receive weekly questionnaires. So for the oldest old, it takes about 20 hours against 8 hours for the youngest ones. We also studied the adverse outcomes, and so we saw that the oldest old has had a higher rate of severe adverse events. And there were more general symptoms as fatigue, pain, degradation of performance status in the older old. We also saw that the RPM device remains highly effective because more than 90% of the patients have a good recovery of their symptoms 2 weeks upon alert, 2 weeks after the alert. So there are very good results. And to finally, we showed that the satisfaction of the patients were really high. So we measured a score called the Net Promoter score, and it was really high with a score of 64, which is very good for this device. So we saw in the data that RPM is highly effective in the older population, that the adherence was really good because we also studied if the patients used the device on a 24 weeks period, and the adherence was still between 70 and 80% at 24 weeks, which is really good. We saw that the RPM was well used by the patients, and the patients were satisfied about it. So we think that the RPM devices should be proposed to all the population under cancer treatment, and the age is not a barrier for the use of these devices. There are other barriers as technological barriers, but clinicians shouldn't be a barrier to propose this device to the patients.